In August 2011, I had a major heart attack, the one that'll pretty much kill you if they don't get you to the hospital in time.
Bob had suffered the ravages of ischemic heart disease. He had suffered a myocardial infarction, a heart attack, and like a certain small but important percentage of patients who have massive heart attacks, his heart never recovered. And he was clearly slowly dying of his heart failure.
About 6 months down the road from that, doing further examination of the damage from the heart attack, it was determined that I would need a heart transplant.
He was evaluated, put on the transplant list.
I called the UAB center at about 2:30 on a Tuesday afternoon and said, okay, I feel comfortable with this, officially put me on the transplant list. That evening at 9:30 my phone rang and they told me I had a heart available. I was blown away, to say the least. Very unusual circumstances. You know, I asked them, were they kidding? Was this like a practice call or something? But they actually found a heart basically 4 hours after they officially listed me.
You know, every heart transplant's a miracle. There's no question about it. It's not only a miracle for the patient, it's a miracle for the surgeon. And I always encourage the nurses and the heart failure doctors who are young in the field to go to the operating room with one of the patients. See the anxiety combined with ecstasy as they're going to the operating room, being put to sleep, the uncertainty of a major heart operation, but the incredible joy that they believe is waiting for them after such a long wait for an appropriate organ.
The day of the transplant was probably the most amazing day I think I've ever lived through. I met both the surgeons that worked on the transplant. Dr. Kirkland tried to put me at ease and asked if I had any questions and was very, very comforting. It brought my nerves down a little bit.
I would say 90% of the patients have a completely different outlook on life within 3 months after the transplant. Most of them, not all, but most are vigorous. Many returning to full employment, like Mr. Boyer.
I'm the Creative Services Director at Fox 54 Television. I do a lot of things outside of my job that kind of come through my job. We do a lot of public events for the TV station. We go out and meet the public and kind of promote the TV station. I also do on the side, we've picked up things like I'm a tour guide for the Huntsville Ghost Walk, which is kind of a haunted history tour around downtown Huntsville. I guess the most unusual thing that I do is for the last 4 or 5 years we've been Santa Claus at Christmas time. The beard gets much longer, it gets much whiter, and we go out and make a lot of kids really happy. And that's the one thing that I'm really happy to still be able to be here to do.
When somebody is referred to our team for heart transplantation, they first are interviewed extensively, examined, evaluated by our medical heart failure team. And then, if it looks like heart transplantation would be a good option for them, then we discuss them as a team and they see the surgeons.
There truly is a team of people. It's amazing how many there are, from the people that do social work coordination. You have a pre-transplant coordinator, a post-transplant coordinator. You have obviously the heart surgeon. You have your attending physician, many of them. They kind of rotate through, but everybody brings their own unique specialty to it, and you really do feel like you're in the care of a great team of individuals who are working with each other to get you the best diagnosis and the best care, as opposed to maybe just one doctor and you wonder, should you get a second opinion? You always have one here because there's so many people taking care of you. I realized I was both very fortunate to live so close to such a great program and to be able to have it on hand when I needed it.
It's very important for all of our patients to understand that they become a part of the team once they're transplanted, that they're not just a transplant patient anymore. They can really have a second mission in their own life, not only just getting better with a heart transplant, but making a difference for others. And so we look for those people, and Mr. Boyer is a wonderful example. And I believe that Dr. McGiffin did his heart transplant in January, comes to a few clinics occasionally, early on was rapidly sent home, and has been really living an essentially normal life since then.
I think the best memory that I've had so far has been my daughter's wedding. It was really unique. We got to have a Christmas theme, which was Christmas in July on July 8th, and it was a lot of fun. Santa got to be there to give away the bride. It snowed. We had candy canes. Kids got to decorate cookies. It was a great memory, and I'm really glad I'm here to be able to have that and be a part of that. That was fun. Really, it's been very anticlimactic. I haven't had any issues so far, thank goodness, and hopefully we'll just keep on. One of the biggest pieces of advice I think anybody gave me was, as long as you do what we tell you to, you'll be fine. And so far that has proved very much correct.